Being a close contact with someone with TB, the things that went through my mind was did I have TB? Did anyone close to my family, other people in my family have TB? She was only diagnosed a few days after she was hospitalized, so we went to go visit her in hospital without any masks or anything before the TB was diagnosed. So that was a big concern because she was really sick at the time.
So yeah, on top of that, we have a little baby boy. He was just above 1 year old at that point. And that was like a major concern for us as well. I mean, he was, you know, with her just a few days before that, always, you know, visiting, and that was like, whoa, big scary moment that he could be affected as well, even at that young age. We all went for a test at that point, taking no chances, whatever the doctor recommended, and yeah, we just went for it.
So the specific tests that we did was the x-rays, which was not easy with a 1 year old, I can tell you that. I think I was sweating when I left the x-ray place. And then also the skin test, which was easy and not difficult at all. And then the thing that was just difficult was the waiting for the results. So as soon as we got the results, everything was easier, and we could. It's the unknown that's really scary. The person who prescribed the TB preventive therapy was the pediatrician. The medicine was a small little white pill, which we crushed into his porridge every morning. And the most stressful part of that whole process was making sure he ate all the porridge. At one stage, he didn't want to eat everything, so then we started putting the pill just in a small section in the porridge and making sure we give that to him.
After seeing what the loved one went through as an adult, and we have a little 1 year old baby boy that had to get preventative of similar drugs, maybe, we don't know, we're not professionals, so we don't know what they're getting. After seeing what she had to go through and then imagining it for him was quite terrifying. But it was way reduced. His pills, the pill that he had to take was tiny, and only one of them, and honestly we can say that we didn't see any adverse side effects at all. And it was a completely different experience, luckily, for us, for that, or for him.
Yes, so it was quite stressful the first few days that we had to give our boy the treatment. But then after that we realized, oh, he's just carrying on as normal. Nothing is happening. He's just got like a snotty nose, and that's normal, right? But every time he got a little bit ill, we would wonder, is it the medicine or not? But he was actually like really healthy for the 3 months that we had to give him the medicine. So our message would be, rather give preventative medicine if you're ever in doubt or feel that you need to take it because you've been in contact with a loved one who has been diagnosed with TB, instead of having to get TB later in your life and having to go through that horrible medicine experience.
I think we learned through this that it's much better to have preventative stuff, preventative drugs, than to have to treat TB actually with all those pills and that make you really sick and whatnot. So yeah, prevention is definitely better than cure, and it worked for us really well with no side effects for our little baby boy. Be open about your disease. I think tell people that, you know, don't feel ashamed about it. It's the only way that you can get treatment for it and people can understand it. Be forthcoming with information. Don't try and keep it a secret kind of thing. And that's the best way to get it treated immediately and it not become a problem later on. A few months later, everyone is through the whole thing and it's all good.
Test and treat to end TB.